Olosh Oyibo Dispensary is 20 kilometers from Ngong Town. The dispensary serves mainly the Maasai community with a catchment area of about 4,621 people. Supervision is carried out from Ngong District Hospital. In order for Ken Ahila to roll out the concept of public address to health information, Olosh Board Dispensary was identified as an outreach. With support from the National Library of Medicine and collaboration with the Ministry of Public Health and Sanitation, Ken Ahila established a model information resource center where she gives expertise in health information packaging and repackaging of relevant different formats for relevant target groups at all literacy levels, including persons with disabilities. The information resource materials are being designed and developed in various formats such as pamphlets, models, pictures, illustrations, posters, audio-visual tapes, display boards, CDs, DVDs, among others. At the moment, the materials are in English and/or Kiswahili. Translation into Kibasai will be done so as to reach those otherwise unable to understand English or Swahili. The health information resource materials are tailored to enhance the skills of the healthcare providers and community health workers. The community, including secondary and primary schools, will also be provided with relevant health information in relevant formats. The reading tent and the dialogue with the community was put up to start off the information access activities by all. This activity will be held occasionally in the center. For Kenya to realize the MDGs, especially 4, 5 and 6, all the stakeholders will need to combine efforts to ensure every Kenyan has access to quality health information. This will empower the communities with knowledge required in prevention of persistent common diseases in respective areas, hence improve on health. Ken Ahila's outreach project has attracted support from other stakeholders, such as the publishers who have been contributing relevant materials for use in the Information Resource Center and the schools around. Among others, Oxford University Press, Kenya Literature Bureau, TBC, and the Maneno Ward.
This is not the first time. We have been coming from time to time, and we are very happy for the response that we have been getting, which is very positive in this dispensary and the area around. Ken Ahila stands for Association for Health Information at the Libraries in Africa. This one is a local chapter from the main Ahila. Ahila, as I have said, it means Association for Health Information and Libraries in Africa. It was started here in Kenya, in Nairobi, in 1984. Ken Ahila, as a child of Ahila, has been active since. The main objective of Ken Ahila is to promote health research, training, and also health information access. We also encourage cooperation between health institutions and sharing of the health information. As far as the objectives are concerned, we have got various activities to support the objectives, and one of the activities is outreach, so where we normally have information access by the communities, as what we are having now here in Oreshoibor. You may be asking how we came to Oreshoibor. This goes back to 2009, where we had a training of trainers workshop in Nairobi, and it was participated by senior librarians from around Nairobi and also outside Nairobi. And the aim was to empower librarians to have skills on how to simplify information, health information for accessibility by the community. This was a combination of various librarians from various institutions, and those part of, some of those librarians, they are here, as you have seen. The concept was public access to health information, and that concept was supposed to be rolled down within the Republic. And that is how we chose Oreshoibor to be the starting point. And that's how you saw, and that's the time that you saw us here launching the concept on the 29th of July last year. We believe that if the community is empowered with health information, getting better health, hence quality health, is very important, and also it is very easy.
educative. And I am very happy, particularly as the facility chairman, because this is not the first time you people have been with us here. There was a time that you came some times back, and you brought us so many materials that have been quite helpful. The young people from this locality and even the old have really benefited from our library in the dispensary. The people have been using the library, and we thank you for the materials you've provided us, because information has been disseminated or has been passed very well. So I want to welcome you. Feel much welcomed. Interact with the people within this locality and feel free.
Kwa mara nyingine mmetukaribisha hapa na moyo mkunjufu. Tunataka kuwashukuru nyinyi wote ambao wamekuja hapa. Yangu si mengi, ningependa tu kualika Ahila timu ambayo imekuja hapa kwa sababu ya hii siku ili mwajue na mjue kwamba wako pamoja nanyi.
I know this is not the first time we have been coming from time to time, and we are very happy for the response that we have been getting, which is very positive in this dispensary and the area around. Ahila stands for Association for Health Information and the Libraries in Africa. Yeah, we believe that if the community is empowered with health information, getting better health, hence quality health is very important, and also it is very easy. We also have the MDGs, which we call them Millennium Development Goals that we are supposed to achieve by the year 2015. And the brilliance, health brilliance normally, I mean, we actually believe that we can be able to assist the government realize the MDGs 4, 5, and 6. So that we can reduce child mortality. We can also reduce mothers' mortality, and also reduce high prevalence of HIV, and also better the life of the society. And so we believe that we are we are kind of the anchor, because we have got the information, and once we give the information to the community, they will be able to do it by themselves. The information resource center that we have here in this dispensary, it is a model of its type in Kenya. So I'm just hoping that you normally use the library, and you have already put down the questions that you want to ask us as far as information vacuum is concerned. Of course, we cannot actually know what you are missing until you tell us. I'm sure those people that were here last time, we told you where we had come from, what we are doing, and what we are expecting to do. We are in the third phase. The first phase was to launch the concept. That is the one that we had last year in July. The second phase is where we are now, that we want to dialogue with you, and then we can be able to understand your information needs. And after you tell us, then we are going to repackage that health information thematic areas that you really need into various formats relevant to relevant groups.
naitwa Jesinta Kinaya. Imetufundisha, watu wengi wamekuja kuchukua vitabu, elimu mingi tumeelimishwa hapo. Magonjwa mengi tulijua, haswa tumefundishwa kama ugonjwa wa kolera na malaria, vile tulichukua nets tukawapea watu wa kijiji na watu wote walifurahia. Pia tulikuwa na mafunzo katika hiyo library, watu wanajionea vile magonjwa yanaenea kama vile ukimwi inavyoenea kutoka kwa mtu mmoja hadi mwingine. Kwa hivyo tumeelimika sana. Mimi binafsi nimekuja kwa library, nikauliza maswali kwa yale ambayo sikuwa najua, nikafunzwa na nikachukua vitabu nikajisomea. Kwa hivyo nikajua, nikapata elimu mingi kutoka huko.
My name is Mbugua. I'm the nursing officer in charge of Oloshoibor dispensary. We have alleviated the health standard of the community. We have educated them accordingly, and the rate of diseases have really gone down. I'm responsible of treating, referring, and teaching my patients and the community at large. The library has been here basically about 10 months ago. We have been able to reach the unreachable. We have managed to reach the people who are far away from the dispensary, and we have alleviated their health status. Concerning the library, we are happy that we have something that we can use to reach the community.
My mandate here is to carry out hospital duties as the chairman of the facility. I've been here for the last 4 years. The experience I have in this place is that we worked with people of this locality. We've done a lot, and we have seen so many things that we've been carrying out here. We've been doing a lot with the people of the locality, with other assistants from other groups. Yeah, we work with them. We have 2 teams that were there. We have the community health workers that at the village level, they work, and there at the village level, they teach people about health, and in case there are problems there at the village, they can bring it to the dispensary. They can forward the cases to the dispensary. Also, they teach people so that we will minimize people coming to the dispensary. Also, we had the facility health committee members where we come to the dispensary and we discuss things pertaining to the dispensary. It has had a very, very good impact in that the facility itself, people from the locality have been using it, all the way from Ilngaroj, Kimuga, and even in Tashat. They have been coming to this dispensary. They have been getting drugs. They have also been getting a lot of help, because we have got a library in the dispensary where they get information, where they get access to information, and this library has helped them. People have been there, especially the youth, has been picking books. They go and read, and they get a lot of information on health.
Huko kijijini watu ni wagonjwa, tukakuta ni watu wanalala huko kila pahali.
Wako wapi?
Ndio hawa.
Walete. Habari za kazi nzuri sana.
Mtoto anaugua ugonjwa wa tumbo, anahara na pia anatapika.
Ameanza lini?
Leo asubuhi.
Na ametapika mara ngapi?
Mara 3 hivi.
Na anaitwa nani?
Anaitwa Mbugua.
Watazamaji wapendwa, mtoto huyu anaugua ugonjwa wa kipindupindu. Ugonjwa huu ni hatari sana, unaweza kusababisha kifo kwa dakika chache. Ugonjwa huu unasababishwa na kutonawa mikono baada ya kutoka kwenye msalani. Pia husababishwa na kutoosha matunda unapoila, na kusababishwa na maji machafu. Ukiuma na tumbo kuhara na kutapika, umuone daktari. Nzuri sana. Habari ya mzee?
Nzuri sana.
Naugua wasa.
Naumwa na macho, sioni hata chochote, saa hata nywele inatoka, sijui inaenda wapi.
Na umeanza kuugua lini?
Nimeanza sasa muda ya wiki moja iliyopita.
Na unaitwa nani?
Naitwa Juma.
Watazamaji wapendwa, mzee huyu anaugua ugonjwa wa trachoma. Ugonjwa huu unasababishwa na uchafu. Na ugonjwa huu unaweza tibika. Umuone daktari unapoumwa macho. Na pia unaweza sababisha upofu. Habari ya mzee?
Sida yule.
Anaumwa na watu.
Roke tuli.
Amesema anakohoa sana.
Na ameanza lini?
Ida gari nao.
Amesema wiki 2 zimepita.
Watazamaji, mzee huyu anaugua ugonjwa wa kifua kikuu. Ugonjwa huu unaweza kuambukizana, unaweza kuenezwa kupitia hewa. Ugonjwa huu unaweza tibika. Unapokohoa kwa muda wa wiki 2, umuone daktari kwa haraka. Watazamaji wapendwa, tudumishe usafi. Wazazi na wanafunzi wenzangu, mbele yenu shule ya msingi ya Olocheiba wako tayari kuwakaria shairi liitwalo
Ukimwi wachakuwa.
Karibuni.
Ukimwi ondoka hapa, unatutia mashaka. Roho zetu zinapapa, jina lako kutamka. Sote tunakuogopa, nani anayekutaka? Ukimwi wachakuwa, tunayataka maisha. Umeua mami yangu, nyanya baba hata mama. Umeua wazungu, wahindi na karabama. Wamaliza ulimwengu, New York na Hiroshima. Ukimwi wachakuwa, tunayataka maisha. Hakuna anayekupenda ila awe hayawani. Mwenye bongo atashinda, ajichunge maishani. Ama sivyo atakonda, hadi kule kaburini. Ukimwi wachakuwa, tunayataka maisha. Nyinyi msiabadilika, sasa leo nawaambia. Ugonjwa unatibika, na kifo hakina dawa. Ukimwi ukikushika, kaburini utaingia. Ukimwi wachakuwa, tunayataka maisha. Siwezi kuishi peke, upweke kweli uvu.
I note that one of your objectives as an association is to promote research and training in health information and services, and that some of the ways you meet this objective is to disseminate health information materials to varied target groups, sharing the same among individual members and their institutions, and participating in outreach activities, particularly in rural areas. This event, I understand, has been designed as an avenue to roll out the concept public access to health information.
Amebuka mshindi.
Ore nani nyana ishindapi?
Anaitwa Faith Nkatia.
Na keji Faith Nkatia.
Ako wapi Faith?
Ore Faith.
Faith, karibu chukue zawadi yako.
Faith tasegua kishoro roino ashu zawadi no.
Ningetaka kumuita mmoja wetu aweze kumkabidhi Faith zawadi.
Ayuna na yo mono bobe kumashoni zawadi.
Emmanuel Oshaibol, karibu kupata zawadi yako.
Emmanuel Oshaibol, karibu. Ore ila Emmanuel, wapi Emmanuel?
Emmanuel akija afuatwe na Joel Kisai. Joel Kisai Emmanuel. Oh, hongera. Makofi.
Ando shokugai.
Okay, huyo ni Joel. Asante sana. Pigie Joel makofi. George Monari.
George Monari.
George, karibu upate zawadi.
Karibu George.
Akifuatwa na Kelvin Nganga. Ako wapi Kelvin?
Ndio Kelvin.
Alafu afuatwe na Danson Kimani Kiru.
Ndio Danson Kimani Kiru.
Asante sana.
Ashole.
Kevin. Yes, mpigie Kevin makofi na Danson Kimani apigie makofi.
Danson Kimani leo shughuli sinyanga.
Okay. Halafu sasa Sophie atanisaidia kukabidhi hii zawadi ya secondary Encourage Boys.
Kero tu Sophia reduni ya ishoyo.
Na mwapigie makofi wametumbuiza vilivyo
Ndio shughuli ndio.
Asanteni.
Ashole.
Anayewakilisha shule ya msingi ya Oloshoibo.
Leo libo na shule Oloshoibo.
Aje hapa tafadhali. Sijui anataka asaidiwe.
Ando nigogi. Ndio naona nigogi.
Alafu tupate anayewakilisha shule ya msingi ya Inkarochi.
Kiyo sininya mwalimu irashiki sukul orangaro Pilmari.
Ndio mwalimu anakuja kupokea zawadi ya Inkarochi.
Ndio mwalimu ingage lodwa domona zawadi.
Zawadi kubwa sana hii.
Kala leo lingi sababu kule.
Sijui angetaka kusaidiwa.
Magala janga ina redu, ando redu.
Nani amsaidie ili hii zawadi ni kubwa sana.
Ndio ndio redu janga misabo ya zawadi ile.
Asante sana.
Ashole.
Ndio wao wana CHW wana pambo vilivyo. Pia chairman wa CHC amefanya kazi kubwa sana na hata yeye apambwe. Apambwe kabisa.
Kwa majina ni Agnes Sein Morito, Oloshoibor Community Health Worker. Ninafanya katika library na imefaidi community kupata elimu ya afya na pia magonjwa wamepata ujuzi kwa magonjwa kama vile ukimwi. Kuna DVDs tunaonyesha na pia kutranslate wale waelewi, na magonjwa pia kama za kuambukizana kama hizi zinaitwa STIs pia wamepata elimu na imefaidi community kabisa.
We are here at Oloshoibor. We are this time around rolling out the concept, public access to health information, with the support of National Library of Medicine and the Ministry of Public Health and Sanitation. We have been able to put up some reading tents and also some dialogue with the community around Oreshoibo, so as to see how we can help each other with the information access. It has come out very clearly that the schools can own up the project and also the community around, because they are able to know what they need and they are able to tell us what they really require. And thereby we are able to exchange ideas and we are able to help each other in getting the relevant information. We have also been challenged by the handicapped, and so we still think we need to load up the project further and cover the those people that are challenged physically. We also have those others that are also challenged visually and also having hearing impairment. All in all, we are very glad that it has ended up very well, and we still think in the third phase, where we are going to repackage information, we shall do it also with the support of the community around also, and also the Ministry of Public Health and Sanitation. We also anticipate that in the final aid, we are going to do an impact assessment to see actually whether it has actually taken base within the community.